Well, back with Dr. Stein. Dr. Stein, we talked a little bit about how missing teeth can perhaps cause headaches, tensions, and definitely make other teeth, which are not missing, lose their stability and become all shifting, and in turn again, throw other teeth out of awareness. Now, what are some of the major, the 2 or 3, ways of how to replace a teeth? A tooth, a missing tooth, or several missing teeth, and give me a little bit of a picture why one might be more applicable at one situation and one may be better for another situation.
Well, there are basically 3 ways of replacing teeth, missing teeth. You replace, the first one would be to do by an implant, by placing an implant, which is an artificial root, and then you build upwards on that. The advantage to that is that you don't have to disturb the other teeth. It feels more like a natural tooth. A second option is to do a bridge, which builds on the adjoining teeth. As long as you have teeth that are strong enough to support, then you can build on the other teeth and you connect. The disadvantage is that because the teeth are connected, it's a little bit more difficult to clean. And then the third option, which is the least beneficial, or the least, I would say the last one to do would be a removable partial denture. That feels the most artificial. The biggest advantage is cost. That's the least expensive, but because it's the most artificial, you have to take it, you put it in a cup, you have to clean it, and then people don't like that feeling. But it's better than leaving the space. So those are basically the 3 options. I got it.
So let me ask you. You mentioned that when you have a bridge, which means 2 teeth holding another one in between, or maybe even 2 or 3 in between, right? So you could have a 5-unit bridge, or 3-unit, or whatever, right?
Yes.
4.
Yes.
So let me ask you, and you said that it's difficult to floss in between because obviously the teeth are all together. You can't get in between with your floss.
Right.
And so for a lazy, I wouldn't necessarily say I'm totally lazy, but for a slightly on a slappy guy like me, my wife and me, when she starts brushing, I have brushed, showered, combed, shaved, I've done everything, and she's still brushing. Would I be prone, because of not flossing correctly when I have a crown and a bridge, that because of it I would get gum disease in that area, and because of it the bridge would actually, so to say, fail? It would have to be taken out again eventually?
It could happen, yes. It is important, whether a natural teeth or a bridge, to clean for the health of the gums. Any impediment to anything that would make it more difficult to clean can cause inflammation, which begins the process of gingivitis, and then can lead to periodontal gum disease, which can cause deterioration of the bone, and may make the bridge fail. So anything that can help to make it as natural as possible, or to make it as easy as possible to keep clean, would be the best option, which is why implants work nicely, because it doesn't disturb the other teeth. Also, the disadvantage to a bridge is that if one fails, then the entire bridge fails. So if the case starts underneath one tooth, then even though the other teeth may be fine, you have to replace the entire bridge, whereas with an implant you would only replace the one tooth. So it's nice to keep things as small as possible and not to disturb or shave down any more teeth than you have to.
Right. Now let me ask you this. You mentioned about, I mentioned, and we both mentioned about the bridge failing. On an average, a bridge versus an implant, what's the longevity? Is there some data out there? Do you have in your office or in the industry, is there some some general consensus out there that one lasts longer than the other?
Generally, crowned bridges, an average is usually considered about 5 to 10 years. As an industry, we hope that it can last much longer than that, but and it can fail for different reasons. Sometimes porcelain can break. It doesn't mean necessarily that the bridge itself is defective, but but on average, it's usually about 5 to 10 years is an average.
Okay. And what about an implant?
An implant can generally last much longer because it doesn't disturb. I would say probably 10 to 20 years as an approximation.
Okay, good. So basically it's definitely longer on an average. I mean, forgetting that there could be accidents or something which happen, which for explainable or unexplainable reason we don't know, but on an average longer. So let me ask you, if that's the case, that it more or less could easily last twice as long, wouldn't that offset the slightly higher cost of an implant versus a bridge?
I would say so, yes. An implant would be my first choice in most cases, except if a patient is maybe a diabetic, or there's certain situations where maybe an implant wouldn't be the first choice. But for a healthy person without any medical complications, then the implant would be the first choice.
Okay. All right. Well, again, wonderful data, helpful, I think, very informative. Thanks a lot, Dr. Stein.
Okay, thank you.